Well, each doctor brings with them a unique perspective on this journey.
And Dr. Adams-Pickett joins us now. Dr. Pickett, can you tell us a little bit about how women should prepare their bodies for pregnancy, especially if they know that they may have some trouble?
Well, thank you so much for asking that question, Renata, because many people think I can just jump in head first or feet first into pregnancy. So I think it's very important to find out if there are any pregnancy history or medical history in your family even that could impact your pregnancy. So if you have a mother, an aunt, a sister who's had preeclampsia, who's had diabetes, who's had hypertension, that may factor into your pregnancy. And that helps you get everything right with your body with those particular areas so that it will not get in the way when we're trying to have a successful pregnancy.
So once you get pregnant, miscarriages can happen. And in 2019, that's when I had my first miscarriage. Heartbeat, went to the next appointment with you, no heartbeat, rocked my world. But really that is a statistic that 1 in 4 women go through this. Is there a way to avoid this? Because the first thought I was thinking was, what did I do wrong?
What did I do wrong? That is the question, and it breaks my heart every time I hear it. Only 75% of pregnancies actually make it to a healthy baby. That means, like you said, 1 in 4 pregnancies will not move beyond the first or second trimester. And a lot of that has to do with just genetics. You're born with every single egg that you were ever going to have. Your husband or your partner makes over 20 million sperm every 72 hours. It's impossible that every single egg will be in tip-top shape. It's impossible that every single one of the sperm will be doing the best that he can do. So they may come together in a way that the pregnancy may not survive. And it has nothing to do with you. Nothing that you've eaten, nothing that you've exercised, nothing that you've lifted. And so I really want patients to know that when a pregnancy loss occurs, that you're part of a large family where that has occurred to many people.
And to reiterate that, so I had, I said I was pregnant 7 times, and I bring this up often because I think it is so important for people to understand that. I had a loss in between my 2 babies, and Ruth did as well. I mean, so these are things that happen more often than you think. And you're right. I think we need to hear that there's nothing that you can do any different sometimes than unfortunately experiencing that.
Dr. Pickett, you mentioned that there's a difference between sperm and egg, and a lot of times we don't think about the male factor. So is there something that the man can do? I mean, a lot of times the women, they sort of bear that trouble when there's a loss or when it's time to have a baby, but what should the man be doing?
Well, again, he needs to look at his baseline health and then look at his family. Has there been a family history of genetic disorders? Has there been a family history of sterility? And when we have the general conversation of fertility, women are the ones that come in and say, okay, I need to make sure I get my body ready to have a baby. You don't hear men saying, I need to get my body ready to have a baby. That doesn't happen. But when we look at the statistics, and Dr. Jordan is going to speak to this in more detail, 40% male factor, 40% female factor equal. So the journey is yours together. So when the unfortunate things happen, that's yours together as well.
We talk about that journey that is so often a woman bears, and that can include high-risk journeys as well as you're going through your fertility journey. And I know we're talking about infertility, but oftentimes that includes things like high-risk factors of preeclampsia, gestational diabetes. Again, all things that you really can't avoid, right? I had both, and I think I kicked myself a million times and said, how do you avoid that? But but you can't.
You truly can't. You cannot will into your head that this is going to be a perfect pregnancy. Every pregnancy teaches us about the next one. So there's no way to know that you say will have preterm labor until you have one delivery where you have a baby early. There's no way to know that there's an increased risk for preeclampsia or diabetes unless you've had one pregnancy where you've had the diabetes. So a lot of times, you know, I have patients, again, they really want the baby story pregnancy, but we're not robots. None of us look the same sitting here. Our histories are very different, so our pregnancies are going to go very differently.
And Doctor, how do you counsel your patients when there is a loss, but then they want to try again? How long should you wait? You know, what do you do in between until it's time? What's that golden time frame that you wait until it's time for you to try again?
Well, I usually look at why they had the loss and how far along they were when they had the loss, because that really will direct the counseling. But typically, if it's a first trimester loss, I'll recommend that they have at least one normal period between attempting again. And after they have that normal period, to go for it. Just go for it.
I love it. What's the most common thing that you find with your patients that come in that want to start a family that they fear could happen? Is it miscarriage? Is it something that even people think about? It was never on my mind.
I think the most common thing that people fear now is that they may not make it through the pregnancy. With the United States having as high of a maternal mortality rate that we have, there are many of us who will read things about mothers who will make it all the way until the time of delivery, and then they'll have an unfortunate event. We were just talking recently about a very popular influencer who had a brain hemorrhage the week before her due date. So I think that is very present in most moms is, am I going to be here to raise my baby? It's a real concern.
As we put a bow on this, final question would be, you really do look at the whole health of the mom and the husband or partner as well. Mental health, as we'll talk about with Ruth, is so important. You see it firsthand when they come in for your post-op and as they're preparing to have a baby, and through that journey. What guidance do you give them just to really make sure that somebody's asking how your emotional state is, right?
Absolutely. I think it's very important that we as a society recognize that while there's so much joy that comes from pregnancy and childbirth, that it truly is a new job. It is a new job, it is a new task, and we have to support people through probably the hardest job that they will ever have.